All right, good afternoon. This will be one of two updates we will do today on the coronavirus. The other will be around 5 o'clock p.m. As we are here as of noon, our numbers are still the same as yesterday afternoon. We're going to update them once a day, and that's 8 confirmed cases, 5 in Harrison, 2 in Fayette, 1 in Jefferson. The individual in Jefferson has been discharged, is isolating at home, is in good condition, and everybody is stable and improving. I know that there has been news out of Louisville. We have to make sure that that sample goes through our state lab because it came from what is right now not a certified lab before we can confirm an additional case. But let us say we expect a number of more positive cases that are going to come back as we move forward. The reason that we have been taking aggressive steps is we believe that we will have a lot more positive results come back. But let me again emphasize, stay calm. The next, and it's probably a couple months, are going to be real disruptive in our lives, but we are going to get through this. It may mean that we have to change the way that we work. It may mean that we have to look for different avenues of doing things, but we can do this. We can get through it together, and we can do it in a way that protects the most vulnerable and make sure that once we're through this, that my kids get to see their grandparents and everybody's kids get to see their grandparents are the most vulnerable for years to come. While we don't know exactly how long it'll take us to get through it, I know that we can. So everybody stay calm, even with all the different news that's coming out. What we are doing and what everybody is doing is taking aggressive steps to make sure we don't see a spike in cases and to try to make sure that we can resolve this without more infection than would otherwise happen and to protect our most vulnerable here in the United States. The World Health Organization has declared this a pandemic. And for those out there that think maybe we're not taking or we're taking too many steps, the World Health Organization has said that it is seeing alarming levels of inaction. That is not us here in Kentucky. We are going to take action. We're going to continue to take actions to make sure that we can protect our people. Before I get into the steps that we have taken, I believe today there are 16 individuals, 16 Kentuckians that were on the Grand Princess that will be returned to Kentucky. The National Guard is going to help return them here. Let me say all 16 have tested negative for the coronavirus. They're going to self-isolate when they are here. We ought to welcome these folks back. Be glad they are back home with their families. They have tested negative. They are going to self-isolate, and we believe that this is a good step for those individuals and for their families. As a recap, steps that we have taken here in Kentucky to date is a state of emergency that gives us the tools we need and the dollars that we are going to need to spend as we address the coronavirus. We've activated the State Health Operations Center and the Emergency Management Operations Center. We've been communicating with all 120 judges, and we have their emergency management networks up and communicating with us. We've initiated changes in Medicaid, eliminating prior authorization and other types of fees or costs that might be associated, especially as private labs come up and get online. We want to make sure cost is not an impediment. Filed an executive order to waive copays and other costs related to private insurers that the state has control over. We've issued an executive order to prohibit price gouging. Those are all the things that would go along with combating this virus. And so if you see people gouging things like cleaners or disinfectants, please call the Attorney General Consumer Protection Hotline at 888-432-9257. We have guidance on our website, kycovid19.ky.gov for everyone. It is updated at least daily. It is the place that people should go to get accurate information. And for those that are seeing things on social media, please go to the website. There's something false out claiming it was coming from me yesterday. Go to the website. It will have the guidance on it. We have our coronavirus hotline up, 1-800-722-5725, 1-800-722-5725. On our website, we have the infographic on when to seek care. It's important that we follow this. If you are well but nervous, do not go to a healthcare facility. Don't overwhelm our healthcare facilities. Call the hotline. If you're sick but otherwise wouldn't seek medical attention, again, it's allergy season. If you have a cough but no other symptoms, don't go to your healthcare facility. Call the hotline. But if you're sick, if you have an injury, get the help that you need. We've published the CDC guidelines. Again, those include folks over 60, avoiding crowds, individuals that are especially vulnerable, heart, lung, kidney disease, those with compromised immune systems, those that suffer from diabetes in Kentucky, take special precautions. Do not fly, do not get on a cruise ship if you are in those populations. But we've provided stronger guidance now here in Kentucky because we believe it's necessary. And that is for everyone to do everything they can to avoid large crowds. We need to engage in the type of social distancing where we can truly impact this virus now because taking steps later in time, if the virus has escalated, will not be as effective as taking aggressive steps now. We provided strong guidance advising nursing homes and long-term care facilities to restrict visitors except for end-of-life situations. It's our job to make sure that we do not have what's happening in Seattle happen here. Again, it's tough. And I understand people want to see their loved ones, but we must do this to protect their life and their health. We signed an executive order that allows pharmacists to refill prescriptions up to 30 days. So those that want to be avoiding large crowds, that don't want to overwhelm the healthcare system, can get a refill from their pharmacist without going to see their doctor. And if we have to set up staging areas, we'll be able to do pharmacy out of them. We've issued guidance from our personnel cabinet trying to lead by example, making sure everybody has the paid leave that they need. We encourage all of our businesses to do the same. It's going to be incredibly important in the coming months that someone does not have a disincentive who is symptomatic to coming back to work, that they have all the incentives that they need to stay home and to self-isolate. We've instructed school districts to be prepared to close on short notice, as short as 72 hours. We held a conference call yesterday with all our superintendents. There are a lot of questions out there, and this type of thing would be difficult, but we won't need them to be prepared because it may well become necessary in the very near future. We've closed all of our state prisons to visitors. Again, that's hard on the prisoners, that's hard on the families, but given the confined space, we believe it's important to protect the life and the health of everybody that works in or is in one of those prisons. We've encouraged every individual in Kentucky to avoid large gatherings and minimize their times in those groups and in public spaces. We have advised all community meetings that can be to be done either over the internet, to be done over TV, if you have that capability, to be done on the radio. And leading by example, we canceled the governor's prayer breakfast, something that I was very much looking forward to, something that is very important. But as I've said, I think that God gives us wisdom to make the right decisions, and I know that these are the right decisions. I've recommended, and this is on recommendation from our public health department, that especially, not especially, but that community meetings, including our houses of worship, look at doing their services online. They look for alternatives to creating a large crowd. We do have a connection between two of the individuals that have tested positive that is their church. I just want to make sure we're protecting our people. I'm a deacon at my church. I serve communion. I serve the type of communion where we hold the cup and the bread and people walk up in a line. And if I close my eyes and I envision what that line looks like, at least half of those in that line are in a very vulnerable population. Other people in that line could be asymptomatic and carrying this coronavirus. As we've seen today, it can impact anybody, even the most healthy that are out there. We suspended out-of-state travel for state employees, and we suggest that businesses do the same. And we've asked people to spread out in meeting and in workspaces by increasing their distance between seats and taking other similar actions. We are trying to model the type of behavior we want to see here in the Capitol. We've made some changes. We're going to continue to make more changes. We removed the seating in the cafeteria because that was an area of density. We're spreading out the chairs in the rotunda. This morning's NAMI event showed that responsibly doing one of those means you have a much smaller crowd that is spread out. And we're urging more businesses to allow employees to telecommute and to provide paid sick leave. We're also working to make sure that people in the media that can't be here, that themselves might have had to self-isolate, can get questions in this and in other press conferences as we go forward. Our job is to make sure, while this is going to impact our lives, we do everything we can to cope and to be creative in how we address it. So Kentuckians, we're going to be okay. It's going to take us time. It is going to be a significant disruption in our daily lives over the next couple months. Remember that about 80% of people who get this are going to show very little symptoms or no symptoms at all. You're going to be all right. But we have a duty. We have a duty both to help protect our families from getting it, and we have a duty to not spread it if we're asymptomatic or if we're symptomatic to other people. And so this is going to take all of us being good neighbors and recognizing and accepting the disruption that's going to come in our lives, so that however long it takes, and we certainly hope that it's months, that we get out on the other side with all of our Kentuckians here with us, especially the most vulnerable. I'm going to turn it over to Dr. Stack to talk just a little bit about the passengers coming back here today. Dr. Stack. There you are.
Thank you, Governor. For the Grand Princess passengers, we have 16 people from Kentucky, as I understand it, on that ship. We were asked about this a number of days ago, and if memory serves, on Sunday, we approved the return of them to Kentucky. So we immediately accepted them back and offered no hesitation to do so. We want to return them with their families and get them back to home as safely and quickly as we can. We have made arrangements and are in cooperation with the National Guard for safe transport from their delivery point here in the state to their homes, and then they'll be in self-isolation for 14 days. There has been frustration voiced in various avenues about that process. I would ask some understanding for the challenge the federal government must be facing, trying to disembark an entire ship of people in an uncommonly controlled manner and then get them repositioned using non-commercial transportation means. I can only imagine the difficult logistics they're facing, but from a Kentucky standpoint, we accepted them back as immediately as we were asked, and we are working with the federal government to help those people get safely home when they arrive here in Kentucky.
Thank you. Thank you. So once again, we're going to get through this. There's going to be a lot of disruption, but let's not lose our compassion for our fellow human being and our fellow Kentuckian. We'll take some questions here, and I will try to read in some questions that we have received as well from those that are unable to be here. Let's start right here.
Thank you. Have there been any conversations about emergency legislation that would be able to stop schools across the state for a period of 30 days?
I haven't seen that type of legislation. Our call with our superintendents, I thought, went very well yesterday. My hope would be that if I made this recommendation, especially if they have that time to prepare, that everyone would heed that advice. We'll have to take any that don't day by day, depending on how the situation escalates. But what we're trying to do here is to prevent a spike of these cases, which hopefully will mean that less people get the coronavirus, but that also we don't overwhelm our healthcare system, so that everyone that does, that truly needs our attention, that we have that full capacity to do it.
What do you think lawmakers need to do to cushion the blow for school districts, and what can you do from the executive end to cushion the blow for school districts and students and parents?
So there is a bill working its way through the General Assembly. I wish I could tell you exactly where it is, but I've been focused on this 24 hours a day, 7 days a week. It would add an additional 10 days that a school system does not have to make up. I very much need that legislation to pass. We very much need that legislation to pass. My understanding is that it is going to have significant support. Hopefully it has unanimous support. I got a lot of questions from superintendents about costs that schools are going to incur. There are a lot of field trips that are being canceled right now, and they should be. Any overseas travel by any of our school systems need to be canceled. And as part of those questions, there are kids that have been saving for 4-5 years to go on those trips. It's just too important right now to protect people to continue on those field trips. So we are also going to look at our ability through the state of emergency to try to alleviate as many of those costs as we can. And I'm going to work as hard as I can to do that. Now, everybody is going to sustain costs throughout this process. It's hitting the economy. It's going to hit our Kentucky businesses. But this is a reality we have to be prepared for the next couple of months. It's just too important. Chris.
Governor, this morning, Senate Minority Leader Morgan McGarvey told me that he suggests that the Capitol and Annex be closed to essential personnel, journalists, and staffers, as well as lawmakers. Do you agree with that? Is it time to think about tightening down the Capitol?
Well, we're not there yet. Where we are in the Capitol is, as you can see today, we are changing a lot of different practices from our cleaning to our number of seats. We are going to put out something that will restrict the number of people that can be in the rotunda at a rally. And if people want a larger rally, we may have the opportunity to do that outside, provided that people engage in the right type of social distancing. What we'll have to be doing is watching to make sure that as much as possible that people follow those good practices. But I'm not yet at the point where we would close the Capitol to all but non-essential personnel.
Could the General Assembly adjourn for the session out of an abundance of
I think that's speculative at this point, and I'd want to talk to other lawmakers. If people had enough concern about that, what I would suggest is they figure out the most essential things to get done, to get them done, and then to take that step. But I'd need to have a long conversation with that leadership. Rylan.
Private labs coming online. Do you know when that is? Which ones they'll be, and are there any right now that are testing Kentucky specimens?
So there are a couple of national private labs that have come up online, but that doesn't mean they're where they need to be in their capacity. We get different time frames on when we will see more nationally. U of L is getting up and is getting online. That's going to be helpful. We expect our other universities in the near future to be able to do it. What I don't want to do is give people an improper timeline or tell people that we know the date that everyone who wants to get a test can get a test. And we want that too. We all want that for people's peace of mind. But right now, we got to be really good neighbors to each other and know that the tests need to be for those that are sick and those that need the most care.
Governor, if you go through the annex, as soon as you enter it, the lobby is lined both sides of the hallway over there, real close together. Is facility security going to do a move along?
Well, what we need to be doing right now is encouraging, and that's all of us. And I hope all of us would say something. I've been doing that in my office. I've been doing that in the rotunda. Let's all just be good stewards here in the Capitol, where when we see people close together, if people want to have a private conversation, they need to go into a room, stand 6 feet apart, and have that conversation. And remember, our duties are twofold. There's some that aren't worried about getting this because they think that they will be healthy, but they also have a duty not to spread it if they're asymptomatic. Morgan.
Is there any mechanism by which the executive branch, you could order schools to close if necessary?
Well, right now, what we're looking at is a potential recommendation. If we feel that there is a greater need, we will look at all of those potential avenues.
Is it possible to do that?
Right now, we're looking at a recommendation. We'll look at other avenues if and when they become necessary.
What authority do you or local leaders have to order large gatherings closed beyond a certain point?
Certainly Washington has passed an executive order. I haven't looked at their laws as compared to ours. This is something, though, where it's going to take everybody agreeing to come together and to get this done. In our society, it's not we can't see a scenario where we are breaking up gatherings of people who've come together, but what we can do is very, very strong encouragement. And for the leaders of groups that would bring people together, you have a real responsibility, and think through that responsibility. And if you're not going to follow recommendations that we not gather, think about every practice you can engage in that will lessen the overall risk of exposure. We would much prefer that you did not have that gathering, but if you can lessen the risk, certainly those are steps that ought to be taken.
We've heard from people that have gone to a medical office or even a hospital that are denied tests. You spoke a little bit about we don't know yet when we're going to receive more tests, but who should be getting these tests and what are those qualifications? Since now it's not just a matter of having traveled abroad, it's also in our own community.
It is community spread. And right now, the tests are being given for those that fall within the CDC guidelines and their clinician's judgment. And it's one where we do not have unlimited resources in testing yet. I really want us to. We are waiting on that day where we do. But until we get there, especially those that are just nervous or who are sick but otherwise wouldn't go to a healthcare facility, understand that there are people out there that are sicker.
What are we waiting on in order to know when we're going to get those tests? Is it money? Is it up to the federal government? Is it production of these tests?
The real thing we're waiting on is our commercial labs that do all the testing from insurance that are a regular part of the healthcare system being up and running with the capabilities that we are very much looking forward to. I will tell you that the time frame I've been given has changed numerous times. I hope that it's as soon as possible, but we ought to be prepared that it may be at least weeks off and adjust both our thinking and our approach to make sure we're protecting those that absolutely need that test. Again, let me say, I want to get to the day where everybody can be tested. I don't want anybody to be nervous, but also understand that you could be tested, you could have a negative, and then you just start showing your symptoms after that. So testing won't be the be-all, end-all. It'll still require all these other steps we're taking. Let's go to Lawrence.
That's the state lab has.
Let's do Lawrence, and then I'll come back to you, Mark.
Both the SEC and the Big Ten have canceled their tournaments. What about the Sweet 16? What's your recommendation? Is it still the same?
Well, they will be coming out, I believe, with an announcement here today. They may think even further on that, given the SEC's and other tournaments and their decisions. I think that avoiding any large crowd is a smart decision now. And just like with what Berea College did, even if we weren't to the place of recommending something, we're not going to criticize anybody's decision that is out of an abundance of caution, doing the things they need to. And we're looking, as we move forward, at that type of disruption and change in the short term.
Well, different topic, but you mentioned briefly the Louisville suspected case out of Humana. What's the process from here as far as determining whether that is indeed a COVID situation?
So provided that that sample came into our lab before noon today, we'll have results on it this afternoon when we get together. Again, we believe that will be about 5 o'clock. I'm trying to do it within about an hour of when we get our results, but we have to do a couple things first. We got to call the clinicians. We got to call the local health department, but we are providing information as quickly as we can. Mark.
How many COVID test kits does the state lab have today?
I repeat these questions sometimes to make sure the answer includes it. So the question is, how many test kits does the Kentucky Department of Public Health lab have today? And I've not given a concrete answer, and there's a reason for that. So I would put the capacity as you're an order of magnitude of hundreds, not thousands and more. We have a highly sophisticated, enhanced certification diagnostic laboratory in Frankfurt, not designed for high volume, but designed for doing tests that others can't do because they're either too sophisticated or too dangerous. So we have enhanced abilities, but we are not a high volume scale production laboratory for most things. That's the case for all state Department of Health laboratories. So our capacity, it was fantastic that it came online as quickly as it did. We were one of the earlier states. We've been able to do all the tests we felt were clinically necessary or epidemiologically necessary. We are not able to do all the tests we want to do. Now, this is important. I'm going to emphasize there's frustration out there. I hear that. I'll look up at the cameras. I hear that. There's frustration. We are doing all the tests we can for the ones that give us the most useful information to either help immediately patients who are sick or to help keep other people safe. But we absolutely rely on the academic centers and then the larger commercial labs to get up to speed as quickly as possible. And that's something entirely outside the Commonwealth of Kentucky's control.
And right now, the largest number of tests we've done in a given day is 20. But we're all looking forward to the time that we can have tests for everybody who needs it. But until then, remember, we have the infographic up on when to seek help. For most people, 80% plus, you're only going to have mild symptoms. And what that means is focusing some of those resources, including test kits, on those that are sick or those that fall within the most vulnerable population is the way that we protect the most people. It's how we are good neighbors to each other.
For parents
so
who
much
may be
going-
concerned, for parents who may be concerned, we hear the message of avoiding large crowds,
Yes.
of not being in confined spaces, to stay 6 feet away. But yet our kids are in confined spaces at school. They are not measuring 6 feet apart.
No, they don't.
So why have schools not shut down yet? And does that concern you?
Well, from what we see thus far, kids are pretty safe themselves. That we have seen very few children that have had symptoms or when they do are harmed by this disease, and that's a blessing. It's hard to see a blessing in the coronavirus, but it appears that kids are very safe. As the dad of a 9 and a 10-year-old, that's a really important fact to me. The concern is that we believe that kids can still spread the virus. And in a confined space, they could spread the virus a lot and then go home to maybe granddad and grandmom, and that's the concern there. Our thinking, and we're talking with different states around us too, is that we've got to make sure that there's enough time if we close schools to where there can not only be some instruction during that period of time, but that we've also thought about meals for kids that don't get meals, that there are a lot of services that school provide that kids might not otherwise get, and to try to at least get enough lead time to where those needs can be met. Because for a virus that doesn't seem to harm kids, we want to make sure our reaction to it doesn't cause harm in children. And so all these things are a real balance. And what I can tell people is we will make the very best decisions we can. And again, it's going to disrupt all of our lives. I never thought that twice a day we'd be doing this, and that this would be every phone call that I have all day, every day, making sure that we get the right advice out there. Lawrence.
Owen County Schools closed today because of a suspected case among an employee of the school.
Right.
What do you know about that? What can you?
I don't have information on that, but what I will say is that the faculty are an important consideration too, and when there is that concern, taking that step is a wise step. So we would be supportive of any superintendent who has reason over the next certainly 24 hours to do what they need to do. But we again are talking with our superintendents right now, trying to give them time to plan, and then we'll take the necessary steps that need to be taken. Morgan.
You mentioned, right, that you're waiting to hopefully have, private sector sort of tests come online. Until then, until U of L gets them up and running, et cetera, is the state lab dependent on just test kits coming from the federal government? And if so, are they sending those kind of in continual shipments, or did you guys get one shipment that you got to make last for a while?
We don't have a concern right now that we don't have enough kits for the process that is being used to determine where to test. We believe that what we have and what will come from the federal government will bridge the time to when those large labs get underway. But let me just say, I want those large labs to get underway as fast as they can, because we want everybody to be able to get tested that wants to. And when there is more large-scale capability, we will have more capabilities as a state of different options we can look at on large-scale testing.
Governor, your decision to tell people basically not to go to church has been met with a lot of criticism Can you explain why you chose churches specifically and not restaurants, shopping centers, fill in the blank?
We in making that announcement, we said every public gathering, every community event. Now, what people took out of it was houses of worship, but we needed to specifically say houses of worship. When our houses of worship skew to the vulnerable population, to this coronavirus, and to seniors. Now, let me say that as an elected official, I didn't take that decision lightly, but my job isn't to do what's good politically, it's to do the right thing for our people. You look at the way we interact with each other in church, which is something I love. I go to church every Sunday. My kids do handbells and choir every Wednesday night. My son's going through his baptismal class and was previously scheduled, and maybe it'll still be there to get baptized on Easter. But everything from how we do communion to where we sit to singing, and even that with its ability to transmit. It's just an area that we believe that the coronavirus is already spreading here in Kentucky. And I'd mention again that I had the knowledge that a direct link between two cases in Kentucky is that they go to church together. So I've got to at least provide people that guidance that are out there. Let me say again that I don't believe that whether you go to church this Sunday is a test of faith. I believe that God gives us wisdom to make the best decisions. I'm not going to criticize faith leaders that go ahead and have church, but please take the steps to at least minimize people's potential exposure. And if you're willing, do those services virtually. Call your local radio station and have them broadcast it. Be creative. I mean, we've got great creative faith leaders and other leaders in our communities. Let's find a way that people can worship, and we can do it in a way where we're not spreading this coronavirus.
The CDC yesterday said that state labs are underfunded and overwhelmed. What's your response to that, and does the state have what it needs right now to respond to that?
Well, I'd love our state lab to be a commercial lab with the abilities that those have, but it was never designed to do that. Our goal is to take the resources that we have, to do the best that we can, and then to take the steps that we're taking right now that without large-scale testing can minimize the spread of the disease. Would we like more funding for our Department of Public Health? Dr. Stack would say absolutely. Would we like more equipment in our Department of Public Health? Absolutely. Maybe moving forward after this, the federal government will provide that. But for now, I believe that we're taking the best steps we can. When we learn more about this virus, because when we have widespread testing, we're going to learn a lot. We may look back and see that we perhaps should have done something differently. But every decision we're making right now is based on the absolute best information we have and for making sure that we're being aggressive in caring about the most vulnerable. Morgan.
You mentioned earlier, I know everyone's pretty nervous right now, kind of analyzing every cough or, anything. Right. Can you just do a brief overview of, what kind of just recommendations for when maybe you should just call the hotline or kind of sit tight and try to just distance yourself from other people, and when it's a symptom that's serious enough, hey, you should go see somebody, so as not to overwhelm folks.
Kenneth, can you bring up our website while we're doing this? On KentuckyCovid19.gov, we have an infographic which I think is the best advice that came from Dr. Stack, and that is if you are well but nervous, call the hotline. Don't go to a healthcare facility. If you are sick but otherwise wouldn't receive help, or you wouldn't otherwise have gone to a doctor, don't call the hotline. If you are truly sick and would have sought medical help and or are injured, then go.
What should physicians do if they encounter a patient who they believe has symptoms? What's the next step in the process?
Let me turn that over to Dr. Stack.
So thank you. So I always try to give you perspective on this. We're talking about a disease that existed less than 3 months in a country here with 330 million people. In healthcare sectors, 1/5 of the United States economy, and we're trying to turn it on a dime. So we're trying to do things at a pace and a scale which are thoroughly uncommon. And so what should physicians do in that context is go to the Kentucky COVID website on a daily basis, find the guidance that is directly applicable to your specific setting, Go to the CDC website, which you can access the key things through our website for specific guidance. The guidance is changing daily. It is no longer sufficient to reference what was there yesterday. You have to look each day. And a good example is for testing. The nature of the testing, how it had to be done when they collected the specimens, was very restrictive initially and has been modified to be more permissive of other ways to collect the specimens that make it more easily available, though I wouldn't say easy all the time, easier to get, and physicians and others need to keep current with that. And I ask your patience, I'm a practicing emergency doc, I ask your patience. We are asking a lot of people to make a lot of changes, including every Kentuckian, with the actions that the governor is taking to try to keep everybody safe. And the final thing is that the testing is of incredible importance, but the testing in and of itself is not the most important thing. It all has to be done in context. When we can do testing more widely, it will be incredibly helpful and help us be more tailored in our recommendations and more evidence-based. But the steps we're taking now, even if we had widespread testing, would still be steps we should be taking now based on everything we've seen around the world.
I have a question for you, Doctor. Could you explain?
Let's take this last one on this. Then I have one question that came in on another topic, and then we're going to have to see you back here at about 5.
Could you explain what flattening the curve is? We've seen it hashtagged all over the place. Can you explain what it is and also how it relates to the measures that the governor is taking?
Thank you. So we're going to see if we get permission from a research scientist who made a paper to show a graphic. I think if we try to do that this afternoon, if you had 10,000 people sick in 4 weeks, you could easily overwhelm the healthcare system. If you have 10,000 people sick over 12 months, the healthcare system could sustain it. They're just using numbers, for example. So you want to avoid a big, sharp spike all of a sudden in a very short period, because then you overwhelm the healthcare system. You can't take care of the people who need care, and then other people who have more common things can't get care, so there's cascading problems. So what we're doing now, these are proven public health measures, and all this stuff, cover your cough, wash your hands, 6 feet distancing, those things work. And if we do that, we can flatten the curve, we can decrease the spike on the front end, and if people get sick, both decrease the number who get sick and stretch it out over a longer period of time so the healthcare delivery system has the needed capacity to care for everybody who does need help. It's a really important concept, but it's not one we would normally talk about around the kitchen table.
So to close, I want to answer a question that's come from our reporters that are with us virtually, and that's for me to react to Auditor Harmon's report on state aircraft. I will tell you that I have not had an opportunity to read the audit. I'm working on this state of emergency every moment, but what I can tell you is we are committed to being transparent about our use of the state aircraft. We are getting that website up that will show every single time we go and who is on the plane. Every trip we've taken is 100% official. When we have gone to various groundbreakings that are in a district, we have taken Republicans as well as Democrats. We are using that state aircraft in a 100% official manner. If the legislature wants to put some of that transparency into law, I'm fully supportive of it. That plane is ultimately maintained by the state, even if it's not technically owned by the state, and we'll do everything we can to be as transparent as we can with it. So once again, I think we will be back in front of you at about 5. Please be flexible. It could be as late as 6:30. Our hope is that it will be closer to 5. Thank you. Thank you.